Good morning once again. We are very sorry for the delay, and I request all of you to please bear with us. Thank you. Good morning and a very warm welcome to one and all. The Department of Dental and Oral Surgery, Lady Hardinge Medical College and Associated Hospital welcomes all of you on the occasion of World Oral Health Day 2024, where today we have gathered for the inauguration of O-PMD Hub, a national resource center for oral potentially malignant disorders under National Oral Health Program, Ministry of Health and Family Welfare, Government of India. It is our privilege to welcome our chief guest, Professor Dr. Atul Goyal, sir, Director General Health Services, Ministry of Health and Family Welfare. Ms. L.S. Changson, Additional Secretary and Mission Director, Ministry of Health and Family Welfare. Shri Rajiv Manjhi, Joint Secretary, Ministry of Health and Family Welfare. Dr. L. Swasti Charan, Additional Deputy Director General and Director Emergency Medical Relief, Ministry of Health and Family Welfare. Thank you all for joining us on this momentous occasion and motivating us with your gracious presence. I also warmly welcome guests from National Center for Disease Control, NCDC, WHO, esteemed guests from other nodal centers and other institutes, respected seniors of our institute, colleagues, nursing personnel, other healthcare staff, students, and guests who have joined us online. Thank you so much for joining us. I would now like to call upon our dignitaries to please take their seats on the dais. May I request our respected Professor Dr. Atul Goyal, sir, Director General Health Services, to kindly grace the stage, and our Director, Dr. Subhash Giri, sir, to please accompany sir. So I request Ms. L.S. Changson, Shri Rajiv Manjhi, sir, Dr. L. Swasti Charan, sir, and I request our Director, sir, and Dr. Rakesh, HOD Dental Surgery, Dental and Oral Surgery, to please accompany the dignitaries onto the dais. Thank you all for gracing the stage with your presence. And I now seek your permission to please give us this opportunity and immense pleasure to welcome you all with a green welcome. Thank you so much. I request Dr. Purvi to please present a planter to our respected Director General Health Services, Professor Dr. Atul Goyal, sir. Dr. Himanshi to please offer a planter to esteemed Ms. L.S. Changson, Additional Secretary and Mission Director, Ministry of Health and Family Welfare. Dr. Archana to please present a planter to Shri Rajiv Manjhi, Joint Secretary, Ministry of Health and Family Welfare. Dr. Shubhpreet to please present a planter to our Director, sir, Dr. Subhash Giri, to Dr. L. Swasti Charan, Additional Deputy Director General and Director Emergency Medical Relief, Ministry of Health and Family Welfare. Request Dr. Kari to please present a planter to our Director, sir, Dr. Subhash Giri, sir. Dr. Anu to please present a planter to Dr. S.K. Rasania, to Dr. We are very sorry, Dr. Rasania had a last moment important meeting, so couldn't join us. We are still waiting for sir. I request Dr. Anu to please present a planter to Dr. Rakesh Sharma, Professor and Head, Department of Dental and Oral Surgery. We envision O-PMD Hub to be a harbinger of hope and life. And light is an eternal symbol of wisdom, strength, power, hope, and life. I now request all our dignitaries to please light the lamp to invoke auspiciousness to our celebrations. Thank you all. I now call upon Dr. Rakesh Sharma, sir, Professor and Head of Department of Dental and Oral Surgery, to please welcome the gathering and enlighten us with an overview of O-PMD Hub. Rakesh, sir, please.
Ladies and gentlemen, a very good morning to each and every one of you. It is with immense pleasure and pride that I extend a warm welcome to all of you gathered here today for the inauguration of our National Resource Center on Oral Potentially Malignant Disorders and the celebrations of World Oral Health Day. Today marks a significant milestone in our journey towards combating oral health challenges, particularly focusing on potentially malignant disorders. As we inaugurate the Resource Center, we are not just opening its door, we are unlocking a wealth of knowledge, expertise, and innovation dedicated to addressing and preventing these disorders. Oral potentially malignant disorders pose a serious threat to the public health, often serving as a precursor to oral cancer. Yet they remain under-recognized and under-addressed in many communities. Through the establishment of this resource center, we aim to change that narrative. We are committing ourselves to proactive research, education, outreach efforts aimed at early detection, prevention, and treatment of these disorders. I would like to welcome dignitaries on the dais. Our own Professor Dr. Atul Goyal sir, DGHS, Ministry of Health and Family Welfare, Government of India. His guidance and blessings have made this day possible. Welcome you, sir. Ms. Alice Changsen, Additional Secretary and Mission Director, Ministry of Health and Family Welfare, Government of India. Welcome you, ma'am. Shri Rajiv Manji, Joint Secretary, Ministry of Health and Family Welfare, Government of India. Welcome you, sir. Dr. Subhash Giri, Director LHMC and Associated Hospitals. We have taken many strong steps under his leadership, today being one of them. Welcome you, sir. Dr. L. Swasticharan, Additional DDG and Director, EMR, Government of India, the architect of National Oral Health Program in true sense. Welcome you, sir. Dr. S. K. Rasania, sir, is not there. It is my privilege to welcome among us Dr. O.P. Kharbanda, ex-Chief CDR, AIMS, New Delhi, Pro Vice Chancellor, MS Ramaiah University, Bangalore. Welcome you, sir. I also would like to welcome Dr. Ritu ma'am, Chief CDR, AIMS. Welcome, ma'am. The center stands as a testament to the collaboration and partnership. It is the product of collective efforts, bringing together experts from various fields, stakeholders from healthcare sector, and policymakers, dedicated to improving oral health outcomes. We have among us Dr. Sanjay Tiwari, sir, Principal PGIDS Rohtak. I welcome you, sir, who have been instrumental in successful partnering of O-PMD portal. A very warm welcome to all the nodal officers from the nodal centers under O-PMD Hub, from CDR AIMS New Delhi, ESIC Dental College Rohini New Delhi, Faculty of Dentistry Jamia Millia Islamia New Delhi, Maulana Azad Institute of Dental Sciences New Delhi, and Postgraduate Institute of Dental Sciences Rohtak. Together, we will leverage our collective wisdom and resources to make a tangible difference in the lives of individuals affected by these disorders. I extend my warm welcome to the IDSP team, headed by Dr. Himanshu Chauhan, Joint Director NCDC, Dr. Subhangi, Technical Team for WHO India, headed by Dr. Mir Riyasat Hussain. I also welcome the WHO team and the officials from Ministry of Health and Family Welfare. Our vision of this resource center extends far beyond physical walls. We envision it as a hub of innovation and excellence, serving as a focal point for research advancements, educational initiatives, and community engagement. I welcome all the NSG members and SNOs who have joined this event virtually. I also welcome senior faculty members from LHMC, present and ex-HODs, hospital AMSs, administrative staff, nursing officers, students, staff from LHMC. A warm welcome to all the dental colleges of India and IDA head office and branches who have joined us virtually. I welcome the NRCs, other NRCs under National Oral Health Program, Dr. Arpit Gupta from PGI Chandigarh, NRC for Oral Health for Elderly and Children. As we embark on this journey, let us remain steadfast in our commitment to promoting oral health and well-being. Let us harness the power of collaboration and innovation to drive positive changes in our communities, and let us never lose sight of individuals and families whose lives we seek to impact through our work. Once again, I extend my heartfelt welcomes to all of you. Thank you for joining us on this momentous occasion. Together, let us pave the way towards a healthier, happier future. Thank you. Let us now focus on the reason why we are here. Oral cancer is a serious growing problem. 6th most common cancer in the world and 3rd most common in India. It affects the quality of life of the patient as well as the family, drains the family of finances also, and had a big negative impact on the economy of the country as well. In India, we get 77,000 new cases and 52,000 deaths due to oral cancer out of these. Overall, 1/3 of cancer cases of world are in India. Lack of awareness, illiteracy, poverty, low caloric diet, and unavailability of easily accessible and affordable treatment facility adds to the problem in our country. Some of the studies say that India spent about 2,386 crores on the treatment of early and advanced oral cancer 1 year alone. That's 2022 data. And the worst thing is that the 70% of oral cancer cases are diagnosed in very advanced stages. As very well said by Dutch philosopher Desiderius Erasmus, that prevention is better than cure. An ounce of prevention is worth a pound of cure, said by Benjamin Franklin. So the best strategy is to early detection, diagnose early, and timely manage it. Some of the lesions, the pictures: leukoplakia, erythroplakia, oral submucous fibrosis caused due to areca nut, betel nut chewing that leads to reduced mouth opening, oral lichen planus, oral lichen node reaction. These cases are mainly seen by the dental professionals or oral healthcare professionals, but can also be seen by other colleagues of our fraternity, ENT people, and also other specialties like dermatology. But let me show you this case. This is a white lesion due to graft versus host reaction. That happens in cases of organ transplants, which are also increasing nowadays. So these cases can be seen by our surgery and medicine colleagues also. So taking all these facts into the mind, our ministry has taken a very strong step by starting a National Resource Center under the umbrella of National Oral Health Program, Ministry of Health and Family Welfare at Lady Hardinge Medical College. The aim of this center is to reduce the disease burden of oral cancer, prevention, and reduce the economic burden of oral cancer on the country. The objectives and the deliverables. First of all is that we are supposed to make a database of O-PMD, an online O-PMD portal, so that we can get a registry nationwide, disease registry for oral O-PMDs of the whole country. Then a dynamic web portal will be linked to the NOHP website. Then that will be a national repository of O-PMDs. And the modules for screening, modules for prevention, management, and control of dysplastic lesions. Other objective is to develop IEC material for training and education purpose, and the O-PMD specific webinars or lectures. Then research and treatment protocol for follow-up of up to 5 years. So this is our O-PMD portal's web page. This is how the centers will do patient examination, then the patient information collection using a patient performa, and then uploading the data on the O-PMD portal. This is the screening performa. So at present we have partnered with 5 institutes from Delhi and NCR, as I mentioned, and we have also had a pilot training session to train the nodal officers, which are present today also. The other objective was to make a reference manual, a source of information, a compact and concise source of information for O-PMDs that can be referred by any practitioner who is involved in O-PMD care. We have developed a reference manual with the help of contributors from all over India, from the renowned institutes of medical and dental fraternity. And we have developed IEC materials for education and training purpose for healthcare workers as well as professionals. The O-PMD Hub, LHMC, also publishes a newsletter regularly, having research articles and the information and about the activities by the O-PMD Hub. These are some of the activities done by O-PMD Hub, LHMC, for patient awareness. This is the screening camp. Various screening camps at all places of Delhi and NCR. This is celebration of World No Tobacco Day in the department. Then this is our O-PMD clinic where we are screening the patients for O-PMD lesions. These are some of the cases. So the way forward is continue screening and provide treatment as per the standard protocols. Develop the IEC materials and initiate research in the field of O-PMDs. We have added already 5 centers, and then we are subsequently going to add centers from all over India so that we can cover pan-India, the most distant and deepest parts of India. We can also take state nodal officers and under NOHP to help us in this job, and also collaboration with dental colleges and IDA. So we will develop a chain of affordable treatment centers, including various oncology treatment centers already, and new centers maybe in the nodal centers of O-PMD NRC. To devise a system of tracking and follow-up of each case, provide support of treatment as well as follow-up. The NRC on O-PMD, along with other partners like NCDC, nodal centers, dental colleges, IDA can integrate with other programs for prevention of O-PMDs. We have a small video of a few seconds just to show our future plan. That video was showing how we are going to expand our NRC to involve the other states after Delhi and NCR, and then cover all over India so that we can make a national registry and then follow up and track those patients for the better treatment. I thank you all for the patient hearing. Thank you, sir.
Thank you, Dr. Rakesh. And let us wholeheartedly applaud this department and for their endeavor for O-PMD Hub as a National Resource Center. So today, as we celebrate World Oral Health Day, it is our privilege that Dr. L. Swasti Charan, Additional Deputy Director General and Director, Emergency Medical Relief, is with us. And I request Sir to please share his thoughts about this significant day. Sir, please.
Thank you. Thank you. Good morning, respected DGHS, Dr. Atul Goyal, sir, Madam LS Junction, Additional Secretary, Mission Director, Ministry of Health and Family Welfare, Sri Rajiv Manji, the Joint Secretary looking after many programs, including National Oral Health Program, and Dr. Rakesh Sarma, who is the head of department and also the man of the day for this event today. And I would also like to acknowledge the presence of many of the doyens of oral health in this country. Dr. Pravesh Mehra is here. He was the previous head of this department, and also one person, you know, in 2014 who used to barge into the ministry and, are you the one looking after oral health? Yes, I'm the one. He said, we need to do this. And then we used to sit down many evenings together informally, and many of the thought processes which has evolved into many actions today are because of him, and we acknowledge you for that. And all others who are present here, the members of the NSG, the National Steering Group, the small group that we used to have for inviting, for advising the ministry on various aspects of the National Oral Health Program, and also Dr. Ritu Dugal, and the previous head, Dr. Kharbanda, was also here, and previous head of CDR, who is leading, the CDR is also our National Center of Excellence for the Ministry of Health and Family Welfare. Today is a really happy day for us. So we have been waiting for an event for an event to launch this O-PMD hub, and Dr. Rakesh has already explained to us why O-PMD hub is important. And I was telling Madam Changshan that, ma'am, if we give one NRC to one institute, the whole institute, including the director, comes and works for the ministry. So that is the added advantage that we have for supporting the program, and we are happy that this is happening today. And today also happens to be 20th of March, which we also celebrate in some way and observe in some way for oral health activities in the country. This has been there for many years, but with the guidance of DGHS, sir, we started, kind of celebrating, increasing the visibility of the National Oral Health, World Oral Health Day in such a way that we write letters to the dental colleges across the country to observe, and also give a competition to them so that we can award the best three. And also we write to the state and the union territory governments so that they can also observe, and a similar kind of a competition among them as well. And also from last year, we started inviting the IDA branches. So in a way, we have involved all the dental colleges, the state and the union territories governments, as well as the Indian Dental Association, in a way that we're working in the principles of the national health policy of involving all stakeholders. We just wanted to briefly take you to the background of this initiative, which we have initiated around the 12 5-year plan, those days around 2014-15, in order to strengthen the public health facilities of the country for an accessible, affordable, and quality oral health care delivery. And the goals were identified as improving the oral health status of the population across all age groups. And every program has a burden survey. And when we start looking for oral health, we did not have a nationwide, regularly done survey, although we have already had a few sporadic surveys. And now we are happy to announce that CDR, the NERITS, which is coming up, National Center for Higher Research and Referral Center for Higher Dental Studies, coming up in the campus of CDER, is entrusted with conducting the National Oral Health Survey. So we will be having the oral health status, and working on that, we'll be improving that in terms of provision of accessible, affordable, acceptable, and appropriate and comprehensive oral health care, ranging from prevention of oral diseases, health promotion, and care, including rehabilitation. We work with two components, like any other program, the National Health Mission component, which we do with the states, and we establish what is known as dental units in district hospitals and below, and we provide them a comprehensive package of human resources in terms of BDS dentist, a dental hygienist, and a dental assistant, and dental technician according to the choice or the gaps of the states. And we also provide fund for equipments which can be ranging from dental chair to dental x-ray, whatever the state particularly needs for that dental unit after doing a gap analysis. And we sometimes feel that if you have the manpower, the equipment is there, but then since you do not have support for the consumables, many of the units do not work. So we also have a provision for providing consumables. And we are also targeting health promotion and also building the capacity in the healthcare delivery system. So we provide support for training and IEC. The tertiary component is required for a program which is very young to push the program further forward. So we keep some of the activities with us for designing IEC activities and the behavior change communication materials in terms of posters, TV, and radio spots. And this we do with the National Resource Centers or the National Center of Excellence in AIMS. We have a lot of material already developed for this. And we also develop oral health training material, operational guideline, policy document. And in fact, when the comprehensive package for the health and wellness centers were coming up, Oral Health Division was the first division who worked proactively with NSSRC to provide the module for the health and wellness center, now called the Ayushman Arogya Mandir, the CHOs for the training module for the CHOs for oral health. So we were the first division who proactively gave that. And also, when the IPSS standards were being revised, then the National Oral Health Division, we work proactively with the NSSRC, and we enshrine in the components of the future health facilities, starting from the sub-center to the primary health center to the CACs and the district hospitals, how we can augment health facilities in terms of dental care. If you see many of the district hospitals, as of now, you will have some specialists as per the norms of the district hospital. But in the same district hospital, serving the same population, it will be just one dentist in one corner of the hospital, which is very, very abysmal effort from our part, from oral health point of view. So the IPSS standards has come up with specialty care which can be available at district hospital, etc. So our oral health, the National Oral Health Program has component which is in an increasing manner. If the state feels that a district hospital needs to be supported with specialties like a dental lab, we even provide that support through the NHM. And we also develop, conduct a lot of workshops and the capacity building, and also conduct national and regional reviews, so that, you know, we are at the same path. And initially, you know, these reviews only help the program grow. In the past, when we were starting new, when we start calling the states, we did not even have a list of state nodal officers way back in 2014. So we had to work very closely with the states, identify one nodal officer, and then actually train them, each one of them, on the PIP guidelines, and that's how the PIP have started coming. And ma'am, now in the NPCC meetings, you must be already realizing that all the states, irrespective of the size and size and whether they have a nodal officer or not, we don't question that now. All of them have started asking for the PIP support, and sometimes we may have to say no in terms of some components like mobile dental van, etc. We try to tell them that you please saturate your physical dental unit first, and then we will see for mobile dental van. So that's how we have grown. A glimpse of some of the early centers. I think this was one sent from one of the northeastern states when we sanctioned for the first center. And the progress of the National Oral Health Program over the years from 2014-15 onwards to 2023-24 has been encouraging for us. We do not say that these are the only units existing in the country. There are other units which are funded by the state government, which we are not counting. These are units which we are funding partially or fully as per the need of the state, and we are growing to 7,000 more units in the country. And the central component of the oral health program, the National Center of Excellence at AIMS has been functioning for providing advisory to the ministry right from the beginning. And also along with that, we have got a very ambitious program, ambitious component of the program known as the National Referral and Research Institute for Higher Dental Studies. In short, we call it NARITS at the AIMS campus next to the present CDR. It is so, the building has come up and aesthetically blending with the existing structure that many of us who are seeing the building for the first time may not even know that a new building has been added to the existing. And very soon, Ritu ma'am is here, we're looking for a date. When we have a function, then we push the other date. So we're looking for a date for inaugurating this grand structure, along with the various functions assigned to it, and the National Center of Excellence for implementation of NOHP existing at CDR. And along with that, we have the National Resource Center for Tobacco Cessation and Oral Health at Maulana Institute of Dental Science in Delhi, working on the integration of the National Oral Health Program with National Tobacco Control Program, working on the fact that many of the tobacco users land up in the dentist and in a dental chair, and the dentist seeing him for him or her for some other reasons are the first people to see the tobacco stains, and they have an opportunity of 20 to 30 minutes operating on that patient, and thereby leveraging on the fact that we can do tobacco cessation by the dentist. So we are growing in that direction, and in future we do not stop there, and we are even looking at the dentist providing lifestyle advices for NCDs as well. So the role of dentist is growing to increase from here. And we also have the National Resource Center for Oral Health Care for Children and Elderly, the pediatric and the geriatric oral health at PGI EMEA Chandigarh. And this is where one more occasion where we are trying to work on the two extremes. We have the program for the national health care for the elderly, and one component of that is edentullousness, where as we grow old, we lose our teeth and the quality of life suffers. So that how a model geriatric dental clinic should look like, and how should we train them, what should be the outreach of the healthcare delivery system to the old age homes, etc. Everything is being worked on apart from other objectives they are doing at PGI Chandigarh. So this is the third center that we are gathered here together, which is working on the oral potential medical disorders. We work on 1.4 billion population of this country, where many people will be living with palliative care, and we are trying to provide them some quality, even though we are not able to increase the number of years to them. And then we have people living with NCDs, whom we are providing diagnostics and management, and also try to maintain that data in terms of the NCD portal. And we still have many people who could be potential patients of NCDs, but because of the fact that NCDs are silent, and unless some catastrophe happens to you, you don't readily come to the healthcare facility. They are roaming around with 300 milligram of blood sugar, and they are roaming around with 160 systolic or diastolic blood pressure, very high, and they are not coming to us. And so we are trying to screen them through the community-based assessment checklist, through the ASHA, who comes and enumerates them at the household. And then we still work with some population where people are walking around with pre-cancers inside their mouth, and they are not cancer, so the healthcare delivery system is not able to catch them there, but the pre-cancers ultimately is going to turn cancer. So this hub that we have here in the Lady Hardinge Medical College is going to be very, very important, and paving a way for healthcare delivery system in terms of oral cancer. And we still work with lots of population, the college students, university students, where we have people who are at the risk of initiating some of the risk behaviors like tobacco use or alcohol use. So we still work with them from programs like the NCDs or the National Tobacco Control Program or the DGAP that we have for addiction. So the glimpse of the narratives over the years, from the construction side, from the designing to the new. I think the last one we need to update this, and the building has already come up. And the celebration for the World Oral Health Day is done in order to increase the visibility of the program, and also create awareness among the public why we need to take care of oral health. And this has been done in various parts, as we had indicated earlier. In 2023, Puducherry was adjusted as the first prize winner, along with Gujarat as the second prize winner, and the Meghalaya as the third prize winner. And also among the medical colleges, RIMS Imphal was adjusted first prize, and MM Maulana College of Dental Science at Haryana was also was adjusted second prize, and the Government Dental College in Nagpur. So way down from anywhere, the competitions were coming in, and then they got the third prize. And the IDA branches, the Bangalore branch and the South Arcot in Tamil Nadu and Karnal in Haryana were adjusted first, second, and third prize, etc. Then
we started our 1-month-long World Oral Health Day celebration with a
today. Can somebody help me? There's a video, I think. Is the video?
We started our 1-month-long World Oral Health Day celebration with a cyclothon to promote the knowledge of oral hygiene and dental care to the common people. Most of the dental college faculties as well as IDA members had participated in this event. The program was inaugurated by Professor H. Priyosakhi Devi, Director RIMS.
Oral health, we cannot lead to a stable life, and oral hygiene is very important, and it is very important for all the public have awareness of the oral hygiene. We should have a good health in our teeth and oral hygiene, and many diseases can occur.
And Professor N. Sanjeev Singh, Medical Superintendent RIMS. And finally, our journey began with a mission to create a healthy life and a healthier mouth. Emo Market is the only market located in Imphal which is run by women, and it hosts around 5,000 to 6,000 women vendors. It was here that we started distributing information, education and communication material and pamphlets to the IMAs to promote oral health awareness. The journey was not easy, as initially there was some hesitance, but finally, with all our efforts, we conquered their hearts. The dental faculty, students, school children, and orphanage centers took pledge for safeguarding their oral health as well as for the near and dear ones at different platforms during pledge ceremonies held across various institutions.
Rotating among the departments as well. So these are
Our college attended the nationwide webinar organized by the Directorate General of Health Services, Ministry of Health and Family Welfare under National Oral Health Program, which is held to flag off the celebration nationwide and to give an introduction to national level oral health program activities. A teachers training program for school teachers on oral health promotion was organized. The role of the school teachers on oral health promotion, knowledge and facts of oral health related diseases, management of dental emergencies in school environment was the areas which were discussed. Certificates were provided for all the participating school teachers.
As a part of this celebration, we are starting and launching this program from your school. So you people are kind of like a pioneer participants for this school. So this is a very small presentation. We will be having 3 topics.
Oral health checkup cum fluoride application camp was held for the beneficiary students of Ramakrishna Mission, GAP unit and other neighborhood children at Seloy Nepali Basti, Upper Char Hazare, Kangpokpi district. More than 100 children received the dental checkup and fluoride gel application for the prevention of their tooth decay. Most of the children belonged to the underprivileged section and below the poverty line. An oral health awareness and interactive program was organized for the security personnel of Manipur Security Services at New Dental College building, and we are proud to say that we brought smiles to their faces. Pitt and Fisher Sealant Program for Dental Caries Prevention was organized for orphanage at Destitute Children Home, Tera Keithel, Sagolban, Imphal, Manipur, and a total of 40 children benefited from this program. I believe that when you put a smile out there, you get a smile back. This quote is truly applicable for the Department of Prosthodontics, a free denture camp for the old age home at Ima Le Morel Women Welfare Association, Nong Thombam Lekai, Imphal, in association with Department of Prosthodontics and Public Health Dentistry, was organized, and free dentures have been provided for the eligible residents, which were delivered on subsequent visits. To promote oral health further, we had also organized a mass toothbrushing program for the students of Ramakrishna Mission, GAP unit, Bishnupur district, where a total of 154 children of different schools had assembled. The principal of health education, Del Shodu, was applied and all the children brushed their teeth in unison after being taught. We had also distributed toothbrushing kits to the children as well as accompanying people. We had also organized various camps to promote oral health awareness at different schools and institutions. We have extended our program to press and electronic media, which were contributed by Dr. Sinam Subhash Chandra Singh, Associate Professor, Department of Periodontology as well as Dr. Rajkumari Surbala Devi, Assistant Professor, Department of Public Health Dentistry. Finally, we have conducted a webinar program for the dental staff and students on the theme New Horizons in Oral Healthcare.
Thank you. I think today's World Oral Health Day celebration here in LHMC is being streamed across the country, and many dental colleges, the state governments are also linked into this program. And the purpose of showing this video was that we would like to have more videos contributing to the National Oral Health Program for this year, so that in 2025, when we are here again on 28th March, we'll have competing states and also many dental colleges, as well as the state governments, as well as the UT governments, and also the IDA branches celebrating World Oral Health Day. And with these words, I would like to once again congratulate the director of LHMC, Dr. Subhash Giri sir, with whom I had the opportunity, whenever we have tea together, sir, when is the program coming up? So I would always be after his live along with Dr. Pravesh Mehra and Dr. Rakesh. Whenever we have any function, either in AIMS or the next program will be in LHMC. I keep saying that next program will be LHMC, and today I'm happy that we are here today to celebrate World Oral Health Day, and on this occasion also launch the O-PMD Hub in LHMC. Thank you very much.
Thank you, sir. This O-PMD hub would not have been possible without sir's support and constant guidance. Thank you so much, sir. I now request our director, sir, Dr. Subhash Giri, sir, to please address the gathering and share the vision of our institute with all. Sir, please.
Thank you. आप सभी का अभिनंदन. Thank you very much for coming. Our Honorable Chief Guest, Dr. Atul Goyal ji, DGHS, Ministry of Health and FW, Government of India. Our guest of honor, Mrs. L.S. Changshan, Additional Secretary and Mission Director. Namaskar, ma'am. Sri Rajiv Manji ji, Joint Secretary. Namaskar, sir. Dr. Swasti Charan, Additional DDG and Director EMR. Namaskar, sir. And all the dignified guests, faculty members, and all the students who are present over here. My dear colleagues and students, I stand before you today with the immense pride and gratitude as we gather to inaugurate the National Resource Center for Oral Potentially Malignant Disorder at Lady Hardinge Medical College. This momentous occasion marks a significant milestone in our institution journey towards advancing healthcare and serving our community with the excellence and compassion. Although this program has taken a long, there were many issues which were sorted out at the directorate level, and those issues could not have been sorted out without the help of our chief guest, Dr. Atul Goyal ji. As we delve into the intricacies of the healthcare, it is essential to recognize a cornerstone often overlooked of the oral health. The significance of the oral health extends far beyond a gleaming smile. It is linked to our overall well-being. Oral health is a vital component of our healthy lifestyle. Although sadly, oral health disparities persist in our society, which affects millions of people in our country as well as worldwide. And the more important is, as our society is having gaps in income, social structure, economy, the culture, and the geographical area, the gaps in the healthcare increases further, and same is true over here also, where the oral health is being kept marginalized in a lower community, deprived people. In such a situation, National Oral Health Program appears to be a beacon of hope in our quest for better oral health outcome. This program is not merely about preventive dentistry. This is not merely awareness. It is a holistic approach encompassing education, access to care, and community engagement. By addressing the root cause of oral health disparities, the National Oral Health Program aims to uplift communities, improve quality of life, and reduce the burden of oral disease. One such endeavor of NOHP is establishment of National Resource Center addressing several lacunae in our healthcare facilities of the country, and our O-PMD hub stands as a testimony to this endeavor. Oral potentially malignant disorders represent a critical health challenge, not only in our country, but worldwide. These conditions, if left unaddressed, can progress to more severe ailments, posing a significant threat to the well-being or even to the life of the patient. By establishing this specialized hub, such as the National Resource Center for O-PMD at LHMC, we are not only acknowledging the gravity of the situation, but also taking proactive steps to combat it. However, the success of the National Oral Health Program hinges not just on government efforts, but on a collective action where the community, where the government, planners, advocates, and other peoples are all involved. I extend my sincere appreciation to our esteemed Chief Guest, Dr. Atul Goyal, for gracing us with their presence and for their unwavering support towards our institution. And without him, without the support of Dr. Atul Goyal, the transition in the institute would not have been possible. Sir, your presence here today is underscore the importance of our mission and inspires us to strive for excellence, and one day we expect this institute will become an institute of excellence. I would like to extend my heartfelt gratitude to our distinguished guest, Madam LHMC, Rajiv Manji ji, and Swasti Charan, and all the nodal officers, deans, principals of the nodal centers which are associated with this program. And as this program will expand just like the spoke and hub model, so we'll be having further progress in the same. I also want to express my deepest appreciation to the dedicated team and who worked tirelessly to establish this unit and keep it functional. Your passion, expertise, dedication have taken the instrumental in bringing this initiative to the level of excellence at par. I am confident that this unit will serve as a beacon of hope for individuals affected by oral potentially malignant disorders, providing them with the care, support they need to lead the healthier lives. As we embark on this journey, with the inauguration of the hub, let's reaffirm our commitment to excellence in patient care, education, and research. Let us work together to raise the awareness, promote prevention strategy, improve outcome for individuals affected by these disorders and malignancy. Last of all, I'll say the prevention is better than cure, and I would like to say two words. I just had with one officer who was also doing a lot of work on the oral health, that 2-minute, twice a day brush will prevent all these disorders. Thank you very much.
Thank you, sir. We are grateful for your constant guidance and always pushing us to do our best. I now call upon Shri Rajiv Manjiji, Joint Secretary, Ministry of Health and Family Welfare, to please share with us words of wisdom. Thank you.
Thank you. Respected Director General of Health Services, Professor Atul Goel sir, respected Additional Secretary and Mission Director, Ministry of Health and Family Welfare, Ms. Lomchom Ghoi Suti Changsan ma'am, Director LHMC, Dr. Subhash Giri, Additional Director, Additional DDG, NOHP, and my colleague, Dr. Swasti Charan, Chief AIMS, our CDR, Dr. Ritu Duggalji, Dr. Pravesh Verma, former HOD and a constant follower of this. He used to come and meet every time and talk about such centers. Dignitaries of the dais, including galaxy of experts, and future of healthcare sitting across this hall. We are here, it's a momentous day, World Health Day, and on World Health Day we are going to see a reality, and that reality is with the development of oral potentially malignant disorder center. When we talk about such centers in the country, what comes to our mind that now we are going to equip with the techniques, with the dedicated center to take care of O-PMDs. And O-PMD could be the first step to the oral cancer prevention place to the oral cancer. We all know the situation of oral cancer. We know what is the prevalence. The prevalence, if we see in the entire gamut of cancer, the prevalence is around 7.5%. And out of 5%, mortality is as high as 5.2%. So look at the scenario. 7.5% get affected by malignancy, oral malignancy, and mortality is 5.2%. It's very high. What should we do for that? So we believe with all such centers, we do not only plan to have treatment, we also plan to have some preventive IAC. We also plan to have, unless somebody comes and shows the mouth, how can you find out whether it is leukoplakia or erythroplakia? I was happy, I was discussing with DG sir that every time for every program we plan for cycling, cyclathon or marathon or running. Should there not be something different for oral health program? Some kind of open your mouth, ha ha ha. Show your teeth, all teeth. Now in the process, you are able to see the teeth. When somebody opens the mouth, fully, wow, experts can diagnose, if not clearly erythroplakia or leukoplakia. This could be visible. Some different kind of thought, some brainstorming. I expect from this center something new on IEC will come, and we shall be able to prevent oral cancer. We shall be able to improve the oral health care of the country as we know the data. In country, only 34% of the people have oral health seeking behavior, 34%. And out of 34%, before this national oral health program was launched, you would be surprised to know that 94% people went to the private centers. So with the launch of national oral health program, with the expansion of the network of dental care centers, this percentage has come down. We are hopeful with the addition of this center, the changes which we visualize, the aims and objectives outlined for the program would be achieved. Thank you very much. Jai Hind.
Thank you, sir. Sir has been constantly supporting and facilitating the National Oral Health Program, not just in Hardinge, but throughout the country. And we are truly grateful to sir, and we look forward to constant support, sir. Thank you. It is an honor that we have with us Ms. LHMC, Additional Secretary and Mission Director, Ministry of Health and Family Welfare, on this day of a new beginning. And I request ma'am to please encourage us on this new responsibility that we've been entrusted with. Ma'am, please.
Thank you very much, and very good afternoon to all present in today's meet, those who are here in the hall with us and those who have also joined online. Dignitaries on the dais, Dr. Atul Goel, Director, General Health Services, Ministry of Health and Family Welfare, Government of India. My colleague, Shri Rajiv Maji, Joint Secretary, Ministry of Health and Family Welfare, Government of India. Dr. L. Swasicharan, our dynamic additional DDG and Director EMR, and looking after the National Oral Health Program. The Director, Lady Hardinge Medical College, Dr. Subhash Giri, and Dr. Rakesh Sharma, Professor and Head, Dental and Oral Surgery Department, Lady Hardinge Medical College. Dr. Ritu Rugal from CDAR AIMS, and former Director, Mr. Kharbala ji, Dr. Kharbala, and of course all the esteemed faculty members of this institution and officials from the NCDC and various other organizations, partnering institutes for the O-PMD web portal, the nodal officers of Center of Excellence under NOHP, state nodal officers, national steering group members, and faculty and students of this august institution, and all other members, the Indian Dental Association branches and dental colleges all across the country who have joined us today. Greetings to you all on the occasion of World Oral Health Day. I'm told that 20th March is selected for World Oral Health Day for a very interesting reason. Seniors must have a total of 20 natural teeth at the end of their life to be considered healthy. Children should possess 20 baby teeth. So 20 is, a very important number in terms of, I think, the dental care need that we have. However, though we commemorate this day, but there is a strong need for oral health care to be an important part of everyday life, everyday activity. And this awareness must be made clear to all across the country, across all age groups, starting from children to even the elderly population. Under National Health Mission, we run a large number of programs, starting from communicable diseases to non-communicable diseases. In fact, most of the programs which we are running, they focus a huge part on the preventive aspect. So it is a great thing that under the National Oral Health Program, there is a lot of importance given to IEC. Today also we will be releasing some new material. And the web portal, the website that's been created, will also be very much useful in taking this message of oral health care across all sections of people. I feel it is very important that the prevention aspect should be hugely popularized, especially among the younger children, the younger generation. So NOHP, this program, and all the efforts in it must be merged with other programs like school health. We need to join hands with the Education Ministry, Education Department, and the different functionaries, because this is a huge segment. In India alone, we have about 24-25 crore children in schools up to the age of 18 years. And once this kind of good dental oral care habits set in, I think that will bring in much better prospects for oral health in the future years. I just saw this exhibition before I came into this hall. The way that this center has been taking care of various defects which are there among children, and also in screening and carrying out surgeries for the oral health, the oral disorders, and the way seemingly innocent oral presence can be mistaken or can be ignored if not diagnosed in time, and can lead to potentially malignant or cancer situation. And that leads us back to our national non-communicable diseases program, in which we are carrying out screening for 3 types of cancer at the grassroots level mainly. That is, one of them is the oral health, apart from breast cancer and cervical cancer. Now, that again leads me to the concern about taking this message, this program, and reaching out from very esteemed august tertiary institutions like Lady Hardinge or AIMS, right down to the grassroots in the field. The lowest formation that we have will be the Ayushman Arogya Mandir, which are the sub-center level, which serve a population of about 3,000 to 5,000. And above them, the primary healthcare centers, above them the subdivisional health or CHCs, and then the district hospital. The screening part and the advisory after screening, what basic care, what kind of steps a person must take. Our people who are manning these, the health functionaries who are manning these centers at the grassroots level, must be empowered, their capacity must be built so that they can not only detect but also give some basic starting point advice to the people before they can, or they are referred to a higher facility. We have at the district hospitals now this dental health care units, as mentioned by the previous speakers. But even today, in many districts, we don't have these are only functioning at for extractions and cavity filling. Basic thing like RCT, we are not yet able to offer at the district hospitals. But we are very hopeful that within a year or two, we are giving all the funds for these in our NHM funds, and they will be able to start these. All people who are in the health sector, I think we need to give more attention to the public healthcare aspect. Public health and prevention and awareness, I think they go hand in hand. Apart from the clinical and the management part, I think this is a most fundamental aspect. And I would request all those in the hall and all those who have joined online that we come up with ways of how to reach out to them. And this center is one key center where there's a lot of potential. You can come up with new ways, innovative ways in which we can address this. The different other centers of excellence and the groups that you have, I'm sure that you would be able to put your minds together and to make oral health care become a very important part. Right now, the country has done tremendously well in terms of providing care for reproductive, maternal, and child health, and in terms of immunization, in terms of various communicable disease control. Many things we have been able to eliminate also. Polio and malaria also we are on the verge. Kala Azar we have eliminated. LF also we are almost close to elimination. But now that's why these more of the focus needs to be given on the non-communicable diseases. We are giving importance to NCDs, and in fact in oral health also, since they are linked, I think more attention needs to be given here, and I am appealing to all those who are involved in this sector to make it accessible, and quality oral health care should be accessible, awareness must be more, and we should bring these services to our people. In geriatric health care, in other, I've seen when it comes to child health in certain countries, even in the school midday meal, they are teaching the children how to brush their teeth, or making them brush their teeth after their midday meal. And if this kind of thing is done at a young age, it's a habit that can very well be established later. And when it comes to the elderly care, it was seen that many of our elderly, they lose function of the teeth, and that impacts upon their what they can eat and their nutrition and their general health condition. We want our population, since our life expectancy is increasing, they should grow old in a healthy way. So how can we provide good oral healthcare services to them? And that will be a very important question we will have to address through centers like these. And how much are we, what kind of assistive care we can provide to them. There are many points that I think at every level, these centers like these can ponder upon and come up with adaptable, very specific training manuals which can be applied, which can be taken on by the community level health workers as well, and make this program have its maximum reach, and then that will translate into success. The ultimate test will be for making this translate from the institutions, from the centers to the field level. So with these, I would like to congratulate the Lady Hardinge Medical College and the National Oral Health Care Program for setting up the National Resource Center for Oral Potentially Malignant Disorders. And I hope that more such centers will come up. And I think there is a lot of ideas that the program also has in mind to implement in the years to come. I wish you all the best, and thank you very much. Namaskar.
Thank you so much, ma'am. And we at Hardinge promise that we will give our best to realize the mission of Oral Health Program and the O-PMD Hub. Logo is not just a design, but rather it is a representation of ethos, culture, quality, and the essence of an organization. I now request our dignitaries to please unveil the logo of O-PMD Hub. We just have a short video depicting the parts of the logo, describing the logo. I'll just replay that. Just give us a second, please.
The O-PMD logo is a harbinger of hope and life. Each component of logo has a definable meaning. The National Resource Center sits on the pillar of National Oral Health Program. Oral and maxillofacial region ensuring health and smile of the country. Leaves represent wellness. Represents the cumulative efforts being put by the government of India to combat oral cancer. Overall, the logo signifies that with proper care and attention to O-PMDs, we can fight oral cancer burden of the country.
This logo indeed depicts the vision of O-PMD Hub very emphatically. I now request the dignitaries to please officially release the reference manual for oral potentially malignant disorders. This reference manual is the outcome of collective efforts of experts in the field, core committee members, and contributors and reviewers from across the country. This manual will serve as useful resource at all levels of oral healthcare delivery. I now request the dignitaries to also please officially release the IEC material for O-PMD. The IEC material has been developed to serve as a source of information for the layman and allied healthcare personnel to generate awareness regarding oral potentially malignant disorders. In complete sync with the vision of Digital India, we now move forward to the unveiling of O-PMD Hub portal. This portal This portal would also be used by our nodal centers, and I request the dignitaries to please come forward on the stage to hand over the credentials of the online portal to nodal officers of various nodal centers. Sir, please. The first nodal center is the Center for Dental Education and Research, AIMS, New Delhi. I request Dr. Shalini Gupta and Dr. Deepika Mishra to please come forward to receive the credentials.
Dr. Varun is there in place of...
I'm sorry, I guess we have Dr. Varun with us. Dr. Varun, please. Dr. Sunil Kumar and Dr. Mansi Atri are requested to please accept the credentials on behalf of their institute, ASIC Dental College, Rohini. Moving on to our next nodal center, Faculty of Dentistry, Jamia Millia Islamia University, New Delhi, request Dr. Mandeep Kaur and Dr. Deepika Bablani Popli to receive the credentials. Request Dr. Sunita Gupta and Dr. Sujay Ghosh to accept the credentials on behalf of their institute, Maulana Azad Institute of Dental Sciences, New Delhi. And the last nodal center is Postgraduate Institute of Dental Sciences, Rohtak. And we have with us Dr. Ambika Gupta, Dr. Mala Kamboj, and Dr. Harneet Singh to receive the credentials. I thank all the nodal officers for being with us today, and we have complete faith that this collaboration with all the nodal institutes would go a long way. I now call upon our revered chief guest, Professor Dr. Atul Goyal, sir, Director General of Health Services, to please share his viewpoints and encourage us.
A very good afternoon to all of you. My colleagues from the ministry, my colleagues from the directorate, my colleagues from Lady Hardinge Medical College, my dental colleagues from across the institutes participating in this program. Students, which year students are you? First year. So actually you just bring them from the class and put them here forcefully to fill up the hall. You see, most of them are busy doing some work either for the next class or perhaps preparing for the tutorial. But then, you know, what you hear here may be useful as a general knowledge. It may not be useful to you as a subject right now, but it may be very useful as part of a general knowledge. So try to listen. A lot of important things were discussed by Dr. Swasti Charan also. Well, I congratulate the Department of Dental and Oral Surgery to have been finally able to launch the O-PMD Hub, a National Resource Center for Information and Data regarding potentially malignant disorders. I think it was going on for a long time. Dr. Swasti must be aware of it. Almost 2.5 to 3 years before finally we saw I was also given those papers to speak something about. where it was also mentioned why this Oral Health Day is celebrated. Madam Changsan has also already mentioned that 20 teeth for seniors. I would like to know the definition of seniors, because a lot of people here, including myself, would have already entered that senior bracket. You are there, Dr. Giri is there, so we already entered senior bracket. So that needs to be defined as well. So let's hope our dental colleagues are able to define that by what age we should have 20 teeth each. Right now, I think we have them. Huh? At 80-20. Okay, I'll keep that in mind. Dr. Logani looks after my teeth, so I think I'll be fine. Well, why is oral health important? It's important not just because of cancers or pre-malignant disorders. It's important because oral cavity is the gateway to the human body, and we must realize it. Optimal maintenance of this cavity is central to a healthy human body. Central to maintenance of health of oral cavity is maintenance of dentition and maintenance of the human microbiome. In all my talks, I mention strongly about the human microbiome, the importance of maintaining it, because oral health cannot be maintained without a healthy oral microbiome. Mr. Maji spoke about showing of teeth. Open your mouth, ha ha ha. I, sometimes jokingly ask my overweight patients to show their teeth in the OPDs and then advise them to use them to chew food. Human teeth, unlike elephant teeth, are not meant for showing but to chew food. Today, humanity has forgotten to spend time on food. I ask everyone, कितना time लेते हो खाने में? कोई 5 minute लेता है, कोई 10 minute लेता है, कोई 3 minute में खत्म कर देता है. So we've forgotten the art of chewing food. And that's extremely important. An old Indian dictum says that every morsel of food should be chewed 32 times before it is swallowed. And let me tell you, a lot of metabolic problems today, including obesity, are related to eating food fast. Because your stomach is not going to be filled up by the amount of food you eat. It's going to be filled up in about 20 to 25 minutes. You may have any amount of food in those 20 to 25 minutes. You can slowly eat 2 chapatis or you could eat 20. So what I mean to say, it's not just about potentially malignant and malignant disorders that worries me. It worries me that a poor oral health or incorrect use or inadequate use of your teeth in chewing food leads to a lot of metabolic problems as well. All the lower respiratory infections that I encounter in internal medicine are directly related to the oral hygiene. The oral flora is responsible for those infections. So how you maintain that oral cavity is extremely vital. Similarly, from oral health to diseases, there are certain systemic diseases that make a patient prone to poor oral health. And one of the most important disease here is diabetes mellitus, which also is like an epidemic in India today. In fact, Delhi is called the diabetes capital of the world. So when Dr. Rakesh Sharma mentioned about prevention, he mentioned about early detection and management. I disagree. I totally disagree. And I also reiterate, as I have always reiterated again, that is not prevention. Early detection and management of cancerous lesions or diseases is not prevention. We have forgotten completely primordial prevention, which should be prevention of that disease as well. Why that disease should occur, we should detect it early and treat it. Why don't we prevent it? Why can't we prevent it? And if modern medicine practitioners actually understand basic human physiology, which I consider is the most important subject to actually understand. Well, Madhulika is a physiologist. She's been announcing all around. So I think your subject is the most important or central to the understanding of anything in medicine. And unless you understand that physiology, you will never be able to prevent disease. It's my belief that even metabolic diseases like hypertension and diabetes are eminently preventable. We don't always have to detect them early and treat them. And you have to look into how you are eating, what you are eating, and your times of eating, including the times of meals. People are today having meals at midnight. You see, with the availability of Swiggies and the Zomatos of the world, you are having your meals at 12 midnight, 1 o'clock midnight, sleeping late, getting up early in the morning. whole human body is interconnected. You can't you separate oral health, you can't separate hypertension, diabetes, you can't separate obesity. They all go together. For that matter, Dr. Varinder would appreciate that hypertension and type 2 diabetes are today there in the pediatric age group. People as young as 13 to 14 years, 15 years are having hypertension, obesity, and diabetes. So what future are we talking of in terms of health? While we observe another day, World Oral Health Day, we have so many days. You just can't, remember. You have a Mother's Day, you have a Father's Day, you have any sorts of days. So I think every 365 days, some or the other day must be there, Swasti. Is it not? We have a calendar. We have a calendar. While these days are important to observe, they stir up thoughts, they increase the awareness. But then, these will not be successful in making the society healthy unless we doctors, I stress that word time and again, understand the physiology of human health completely for our own health and our patients' health. So I think with these few thoughts, I should end, because I'm not going to talk about the causes of oral cancers. A lot of people here are aware of that. So please take care of your health. Start with oral health. Well, Swasti mentioned one more thing. Be proud of your oral cavity. Be also proud of what you speak from that oral cavity. Because sometimes you can utter extremely hurting words for a person who could be hurt beyond certain things. So be very careful of what you are speaking to others, at what time. That hurt is irreparable, because that hurt can go right up to the soul and actually injure a person badly, spoil his career as well. Thank you so much.
Thank you, sir, for your encouraging, motivating words. And sir, listening to you is always a wonderful learning experience. And we are fortunate to have you with us, and keep repeating these learning lessons. Thank you so much, sir. I now request Dr. Amarjeet, Professor, Dental and Oral Surgery, to kindly propose the vote of thanks.
Respected dignitaries on the dais, distinguished guests in the audience, respected faculty members of Lady Hardinge Medical College, dear students, ladies and gentlemen. A very good afternoon to all of you. On behalf of the Department of Dental and Oral Surgery, it gives me immense pleasure and honor to extend a heartfelt vote of thanks on this auspicious occasion of the inauguration of O-PMD Hub, a National Resource Center for Oral Potentially Malignant Disorders. First and foremost, I would like to thank the Almighty God for blessing us this day and for making this event possible and hopefully a success. Today marks not just the beginning of a new chapter in our institution's journey, but also a significant milestone in our collective efforts towards addressing a pressing public health concern. I would like to express our deepest gratitude to Professor Dr. Atul Goyal sir for taking his time out of a busy schedule to join us today and inaugurate this center. Dr. Atul sir has been a pillar of support for Lady Hardinge Medical College throughout, and he's played a very strong role for the success and future of this project. Sir, your presence here not only adds immense value, but also serves as a source of inspiration from all of us. I extend my sincere appreciation to our esteemed guests, Additional Secretary and Mission Director Ms. L.S. Changsan Madam, Joint Secretary Shri Rajiv Manji sir, and Additional Deputy Director General Dr. L. Swasicharan sir, in helping and supporting the NOHP program in a great way, and for sharing their invaluable insights and expertise with us today on the occasion of World Oral Health Day. I would also like to extend our heartfelt thanks to the dedicated director, Sir Dr. Subhash Giri, Lady Hardinge Medical College. The institute has taken many strong steps under the leadership of Dr. Giri, and this NRC is one among those to add one or more achievement for the Lady Hardinge Medical College. Sir has always helped in all the possible ways to make this O-PMD hub successful. Sir, your commitment and passion towards advancing knowledge and improving healthcare outcomes has been truly commendable. Another major contributor for this resource center has come from the IDSP team headed by Dr. Himanshu Chauhan sir, Joint Director NCDC. I would like to thank sir and his team consisting of Dr. Shubhangi, Dr. Shyam Singhal, along with the technical support team of World Health Organization India, headed by Dr. Mir Riyasat Hussain and others. They have spent a lot of time in developing the portal and making it functional well in time, and we are extremely thankful to them. A special word of thanks goes to all the heads of the nodal centers and all the nodal officers of various institutes in Delhi NCR region who have generously supported us in this endeavor by partnering in the O-PMD Hub portal. Your contribution has been instrumental in making this center a reality, and we are deeply grateful for your continued support, and we hope that your support is there in the future also. I would like to place it on record the contributions of various authors and experts of the reference manual, which we just released today. Your unwavering commitment to advancing knowledge and improving healthcare outcomes is a testament to your passion and dedication. I must also acknowledge the invaluable contributions of our National Steering Group members, whose meticulous planning and attention to detail have ensured the best outcome of the reference manual. I would like to thank the National Oral Health Program Division team at the Ministry of Health and Family Welfare, including Dr. Ankita Piplani, consultant NOHP, and her team for their continued support and guidance for us. A special mention goes to Director Professor Dr. Pravesh Mehra, previous head of the Department of Dental Oral Surgery, who envisioned this idea of developing the O-PMD hub in the first place and whose efforts spearheaded the setup of this NRC. Furthermore, I would like to thank the stage management committee, the designers, the audiovisual aids people and decorators for their hard work and dedication. The design team consisting of Mr. Roop Singh Soni, Mr. Ashish Arora and Mr. Samir Pawa, they have worked tirelessly, and their collective efforts have transformed ideas into a tangible source that will benefit healthcare professionals, researchers and students. I express my heartfelt appreciation to the project team, including Dr. Navraj, the project consultant, and Dr. Renuka, the project officer, whose diligent efforts were instrumental in making this event a memorable one. I would like to also thank Dr. S.S. Karthikeyan, who initiated the work for the development of the O-PMD Hub portal, as well as the residents, students and staff from the Department of Dental and Oral Surgery, including Mr. Rahul, Mr. Naveen and everyone else who have helped in managing the event well. Last but not the least, I must acknowledge the hard work and dedication of our organizing committee headed by Dr. Praveen Mittal Madam, and including Dr. Rajiv Bandhu Sir, Dr. Madhulika Ma'am, Dr. Mary, Dr. Gaurav Agrawal, Mr. Gaurav Agrawal, Mr. Avnish, Mr. Mithilesh, and the account section and our drawing and dispersing officer, Mr. Pavan Kumar, among others, and volunteers including security and sanitation staff who have put in countless hours to ensure the success of this inauguration event. Your attention to detail and tireless efforts have not gone unnoticed, and we are immensely grateful for your commitment to excellence. In the end, I would like to thank each and everyone who I may have missed unintentionally and who has contributed to the success of this program. To conclude, I would like to express my sincere appreciation to each and every one of you for being a part of this momentous occasion. With the establishment of this National Resource Center for oral potentially malignant disorders, we are taking a significant step towards promoting awareness, prevention, and early detection of these disorders, ultimately contributing to the betterment of public health. Thank you once again for your unwavering support and participation. Let us continue to work together towards our shared goal of creating a healthier and brighter future for all. Jai Hind.
Thank you, Dr. Amarjeet. With this, we come to the end of today's celebration. We sincerely wish and hope that the O-PMD Hub is able to serve its purpose to the best of its capability and goes a long way to fulfill the mission of achieving oral malignancy-free India. We would like to commemorate this day with a group photo, but before that, let us conclude the program, and I request everyone to please stand for the national anthem. पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तब शुभ नामे जागे तब शुभ आशीष मांगे गाहे तब जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे. Thank you all for joining us and request everyone else to please join for lunch in faculty cafeteria on first floor of the building. We also thank the online guests and I request the officials from the ministry, members from NCDC, WHO, Nodal Center. I request the dignitaries to please stay on the stage for the group photograph. And I request the officials from ministry, members of NCDC, WHO, doctors from nodal centers, members of national steering group and other faculty of our institute to please join us for a group photo. And after the photograph, I request all the faculty to join us for lunch. I request all faculty to please join us for a group photograph. Students are now requested to join back for their regular classes. And thank you so much for joining us.